So my family and I were on vacation last week, and we actually were able to go to Disney World for it's been a long time since we've been there. Thanks to the pandemic, things were a little bit less expensive, but we did have to wear masks, as you can see, the whole time. This is my youngest daughter wearing a mask, petting a goat at Animal Kingdom. So we walked from Animal Kingdom into the veterinary clinic, which is right next door around here to the right. And I walk into the room, and here's what I see. There's a screen up here with a 3D x-ray of an animal. And I'll tell you what the animal is here. Maybe you can take some guesses here in just a minute. You can see up here on the wall, they've got a couple of screens showing what they're doing over here, and I'll show you those in just a second. But I walk into this room, and we've just recently installed our Cavo OP3D Pro, and so of course my mind has been thinking about it, and I actually had answered a couple of questions from one of my associates here relative to 3D. And I walk into the Animal Kingdom at Disney World, and they're using a 3D to analyze what's going on here for this patient. So I mean, you can actually see as we zoom in what they're looking at here. They've got some sizable problems here on several of these teeth. So let me slide through here. Here's another view. You can see the animal here covered by a little bit of blanket. This is their CT, so they have an open CT machine. I don't know anything about this machine, to be honest. I didn't really ask. But it's a different design than what we have. Of course, they have animals that probably couldn't sit in a chair and, hold things together, so they sedate them and slide them in, and, more of a conventional CT design. But really interesting how many people they have working on here. They've got a couple of keepers, and then a couple of veterinarians, and then one veterinary dentist. Obviously employed by Disney World, Animal Kingdom. But here's a little more zoomed in view. You can see the slicing here that they're looking at. This is a little different software that I'm familiar with. But obviously, on what I would call tooth number 3, or maybe that's tooth number 14, we have a very large abscess developing here, some significant bone loss there, and potentially something here depending on the slice angle. So there are some problems in this little animal here. Have you guessed what the animal is yet? More images, more views here. Really interesting. Joe Feldstein and I had communicated just a little bit about this. It was just kind of mind-blowing, really surprising to me that I walk into this room and all of a sudden here's this 3D stuff. So this is going on not only in dentistry and medicine, but also in veterinary medicine. And probably I would imagine, and I'm fairly confident this is true, that dentistry has been one of the later adopters of the 3D imaging. There may be some dentists who adopted very early, which is fantastic, but probably as a whole, dentistry has been slow to adopt. So here's an axial slice, and you can see, significant bone loss here. Let's zoom in a little bit. I didn't take any videos, sorry, so what you're looking at is, these are pictures. I'm just cycling through them in my photo album here. Significant bone loss around multiple of these teeth. Lots of problems. Lost the bony cortex there on both sides. Poor little guy wasn't brushing his teeth, I guess. Maybe they're feeding him too much sweets, I don't know. Maybe the people at the park are giving him too much, Cheetos or whatever. I solemnly swear I never fed Cheetos to the monkeys at the Kansas City Zoo. Wink, wink, nudge, nudge. Okay, so did you guess what the animal is yet? Here's another axial slice. You can see that large abscess. Pretty funny. This animal is a porcupine. You can see the animal here. This is the best shot I got of it, just of the screen that was of the camera looking straight down. So the animal's laying on his or her back. These are the incisors, the upper and then the lower ones coming up. There's the tongue. Here's the nose. I think this is an ear, and the eyes are probably closed right there. Of course, the animal is sedated on a breathing tube there. And then there's one of the veterinary techs or dentists or whoever looking at the animal. But really pretty amazing here that we're using this 3D technology to evaluate veterinary animals, just like we're evaluating human animals, and the opportunities that we have to identify disease that we wouldn't be able to see otherwise. I mean, we could probably get a hint of some sort of an abscess and where it was, but you get a really clear picture of what's going on, being able to see the location and basically the extent of the problem with this 3D technology. So it's nice that we're able to treat animals just like we can treat the human animals, and now in dentistry we're starting to be able to really evaluate and diagnose our patients in a way that provides a higher level of care, identifying and treating this this oral disease, orofacial disease, that has a significant potential to impact their whole body health. Anyway, I thought it was interesting, wanted to share with everybody, just kind of an aha moment, just, walking to the room and was kind of blown away to see this stuff. Maybe I shouldn't be, but I was. All right, thanks for watching.